It's past 7 o'clock. We'll just wait for a couple of minutes before we start. I think people are still joining in.
Sure, sir, sure.
It's 7:05. I think it'll be good to start now with whoever has joined. Whoever is registered may join in a few minutes or what. I think we have to be respectful of the people who have joined in at this time. Thank you so much, all of you, for joining in for this important session on dengue awareness and chikungunya also. So we have a lovely host of doctors who will be taking us through a presentation and then followed by a Q&A. Now, I think sequence-wise, Mr. Ravi Shankar, first we go to Dr. Kamala.
Yes, please, sir. Yes.
Oh, okay.
I have shared the agenda with ma'am.
Yeah. So Dr. Kamala is here with us. She is an apartment president. She is has been in apartment as a committee member, as a board member, as a president of apartment committees, while at the same time she's an accomplished medical practitioner. We have her as the moderator, and this session is jointly organized by the Health and Family Welfare Department, Arogya City, Art Park, and Bangalore Apartments Federation. Welcome to this session. Thank you for joining in. Over to Dr. Kamala.
Good evening, all of you. Am I audible?
Yes,
Sir,
doctor, you are. Maybe
Thank
slightly
you.
increased volume will be better.
Yes, audible.
Welcome all of you to this webinar. We will try to learn some points about the dengue and chikungunya control in our Bangalore. So as sir told, this is organized by several departments, and this program is very important for all the apartment communities. So we have assembled here to learn and also try to practice the same thing in future. So what we have to do is to encourage the residents to be aware of the program and also practice the preventive measures as well as what should you do even if you get some people with the fever in the apartment. These are the issues which will be discussed by three doctors who are in the panel. So ward committees also will be helping us to take care of all these issues. So for that purpose, first I will introduce as a speaker Mr. Dr. 𝗕𝗔𝗙 𝗣𝗵𝗵, Joint Director of NVBDCP, Karnataka. He will start the program by setting the context. He will be the point of contact for us in future also. So he will give his contact details at the end of the program. So let us start the program with Dr. Suresha. Shall I introduce others also now only or later, sir?
Ma'am, Dr. Sharif sir will start it.
Yes, okay. So I will introduce Dr. Sharif.
Yeah.
Dr. Muhammad Sharif, Deputy Director, and he is also belonging to NVBDCP, Karnataka chapter. He will talk about dengue and chikungunya situation, overview, vector control, and community role. Being an expert in the field, he will be able to make us understand more about the two diseases, how to control them in a preventive way. We hope that we can be sure of implementing these suggestions advised by him. Over to Dr. Suresh.
Over to Dr.
Good evening,
Sharif.
madam. Yeah, good evening, madam. Thank you very much.
Thank you, sir.
Ravi Shankar, can you share the PPT?
Yeah.
Okay. So welcome everyone for today's dengue and chikungunya awareness webinar. So this is the second in this session we are doing. Last week also we had one session regarding this. This will be almost a repeat of the last week's. So as you all know, there is dengue and chikungunya presence in GBA Bangalore since almost last 2.5 decades. So this is a threat which every year during rainy season, June, July, August, September, October, till November, we face this disease burden, and many Bangaloreans suffered from this disease due to lack of how the preventive activities we can do in our homes, in our offices, in our schools, colleges, in our surroundings, so that we can prevent this mosquito breeding, which is dengue causing mosquito Aedes aegypti, which is a day biter, and understanding how the threat can be we can prevent, and how it spreads, where it breeds, and when it bites. So all these things in the next 25 to 30 minutes, I will be briefing you. I will take you through today's agenda points will be understanding the threat, how dengue spreads, and why apartment communities are particularly exposed, breeding sources in gated communities, the specific spots inside your home, inside your office, inside your compound, surrounding your houses, surrounding your apartments. So how mosquito breeds, why your surroundings matter, not just your home or a flat or office. So the mosquito does not recognize your compound wall, that it can fly up to 500 meters, adult Aedes aegypti mosquito. So one mosquito lifespan is around 25 days to 30 days, maximum 1 month or maybe 35 days. So in that period, it lays almost nearly 800 to 1000 eggs. at one point of time it lays around 200 to 250 eggs in 4 to 5 batches in its lifetime. So what you can do as a resident, resident of GBA Bangalore, how you can I mean do some activity on a daily basis or weekly ones, so that these breeding spots, breeding sites can be eliminated, and dengue should not be a problem for Bangaloreans. So that is the today's context. So next slide. Aedes aegypti, understanding the threat. See, on the left side you can see this mosquito, which is like we call it as a tiger mosquito or a day biter. It is a container breeder. So there are many names for this, because why we call this tiger mosquito is it is having white and black patches on its body and legs. So that's how we identify this Aedes aegypti mosquito. It bites during the day. So majority of the times in the evenings or night times when we sleep, these Anopheles culex mosquitoes, disease spreading mosquitoes, they bite during evening and night time. But this mosquito's speciality is it is mainly accustomed to bite during daytime when we are in the office, in the home, in the schools, colleges, when the elderly people or children, they are sitting in the home or sleeping, students sitting in the classroom, the officials or the office going people who are working in the offices, so construction workers when they are working in the construction sites. So it is a day biter. So daytime it bites, unlike other mosquitoes, early morning and late afternoon usually. And one more thing about this disease is there is no specific treatment or vaccine. So we are hearing about this vaccine, but still it has not come to our medical stores or hospitals so that we can take the vaccine and we will be safe from this disease. So still we are waiting for the vaccine. No specific treatment. There is a symptomatic treatment. When there is fever, they give paracetamol. Headache, they give paracetamol. Then if there is a fluid loss, they give fluid. Platelets, if it is platelets is less, give platelets. So it is a symptomatic treatment, and there is no specific antidote or antibiotic or a specific treatment modality for this disease. So we need to worry why if there is no vaccine, no treatment, then we are only having prevention. Prevention, like the saying is, prevention is better than cure. So prevention, how we can prevent this disease. So for preventing this disease, we need to know how it spreads, how we acquire this disease, from where we acquire, what is this mosquito, where it breeds, where its progeny is coming out. So that's how we need to have some specific points where we should, if we know that, we can prevent this disease. So this mosquito breeds inside and surrounding our houses. When there is a water, clear water, clean water, it is not a dirty water or a drainage water where it breeds. It breeds in the clean water and container. We call this Aedes aegypti, it is a container breeder. So its lifespan will be around 25 to 30 days. But when it lays eggs, so egg will become pupa, larva will become pupa, and pupa will become adult within 5 days to 7 days, maximum 1 week. So within 1 week, one mosquito can become 200 mosquitoes, because at one per batch it lays around 200 to 250 eggs. It lays its eggs within the containers where water is there, open water. Like for example, we keep water in the money plant, the show plants, the flower pot, the plant pots will keep. Below that we keep one plate. So when that plate also, if there is a water uh, in the plate which may be accumulated, usually we will see during rainy season, and if we pour more number of large water in the flower pot, then it gets accumulated in the plate below the flower pot. And also there are some other things like due to scarcity of water, we store water in drums, buckets, containers, and we keep it open sometimes. And also, we throw away the waste like coconut shell, plastic bottle, glass bottle, or plastic waste. So, when in the rainy season, if that waste, coconut shells, all those things, if they accumulate clean water, then these are the breeding sites. Like how you can see in these photos, the tanks, overhead tanks. If it is kept open, then there will be a breeding. The water logged in the terrace due to some blockage in the drainage pipe. Then if the water stored on the terrace, then it is a breeding site for mosquito. Next slide. So, what are the myths and facts? What usually we hear only dirty water breeds mosquitoes. No, this Aedes aegypti mosquito, it breeds in clean water. Even a bottle cap is enough. 2 ml or 5 ml water is enough for this breeding of this mosquito. Then second one is dengue spreads from person to person. Only these mosquitoes, Aedes aegypti mosquito, are responsible for spreading this dengue from one person to another person. Like COVID, it does not spread airborne, or by touching it will not spread. It spreads by the bite of Aedes mosquito. Fogging alone can eliminate dengue. So usually we think if we do fogging, then we can eliminate dengue. No, it is not the fact. If you do fogging, only the adult mosquitoes which are there in the environment, that will die. But the larvae, the pupa, the eggs which are there in the containers, which are there, then again next day or after 2 days, it will come out as mosquitoes. So fogging is not the solution. The only solution will be the reducing these sources where this mosquito breeds, the open water containers, the flower pot, the money plant where we keep the water, where the plate which we are keeping below the flower pot, and the waste which we have thrown in our compound and outside, the drum or the bucket or the container where we keep the water without closing that openly. So these are the sources: the coconut shell, the plastic bottle, the waste plastic or the waste containers which we throw behind our houses or in the open site or outside in the compound. So those are the containers which store water, clean water in the rainy season. That is the breeding that we have to reduce. That is what is called source reduction. At the point of breeding source, that has to be not the fogging. Fogging will not give the solution. So many things that mosquitoes have come down due to fogging, but again the mosquitoes will come. So you can only get dengue once. That is also a myth, but one person can get dengue 4 times in his lifetime, because there are 4 serotypes of dengue. The virus, which is of 4 types, it is like 4 diseases. Dengue is not one disease. It is like 4 diseases because it is a 4 serotypes. If one person is getting with type 1 serotype, again he may get type 2, again type 3, type 4. So repeated infections are dangerous because there is antigen antibody reaction in the body, and that leads to organ damage and complications. So we have to be careful saying that if we get dengue once, so we will not get again. It is not. It is a myth. Fact is, one person can get 4 times dengue, and repeated again. If dengue comes, it is more dangerous. Second, next slide. So Aedes mosquito life cycle, as I already told, adult mosquito, when it takes blood from, it requires blood for production of its eggs. It requires protein, hemoglobin. It is there in our blood. So it takes blood and it produces eggs by mating with male and female. So then the eggs are being in the containers wherever there is water. So the mosquitoes knows where to lay its eggs. It senses the water, then only it lays eggs on the side of the container. So eggs develop into larvae within 1 or 2 days. Then larvae stages, first stage, second, and third larval stages, molting between each stage. Then it converts into pupa within 2 to 3 days, and it comes out of the water as an adult mosquito. This whole life cycle will take 5 to 7 days. So on the right side, you can see the eggs which are laid on the side of the container. It does not lay the eggs on surface of water. It lays on the side of the container. So that's why we say whenever you are cleaning the containers, the drum, the bucket, or the water containers, everything, you should rub the side of the container and wash it cleanly so that these eggs are washed away. If we does not clean it properly, the containers and all, the eggs will be there. When the water comes in contact, it will become larvae and pupa and adult. So that's how it is the life cycle. Next. So these are the spots where we usually see in Bangalore. This flower pot, the plate below the flower pot, stagnant water in flower pot plate is a perfect place for mosquito to breed. So maximum we see in Bangalore, everywhere compound wall they have kept, inside the houses, within the compound, entrance, near the entrance of their house, by the behind their houses, everywhere they keep these flower pots. It is a fashion now. So they will keep this plate below that to prevent this water leakage on the ground and to prevent that water from going on the floor. So that plate will hold that water, and it is a perfect breeding site for this mosquito. We have seen maximum. And this bottle, flower pot, money plant bottle, then this cup, see the pupa, right side, you can see the pupa. In this plate, you can see the eggs. There are more number of eggs. So these are some of the places inside our houses. Within the compound of our houses, we see this type of breeding of Aedes aegypti. Next. So some of the other types of like tires, the overhead tank, if it is kept open, AC cooler trays in the rainy season, flower pot, then water stored on the terrace if the pipe is blocked or if the water has not been flown properly, if it is water stagnation there, and then discarded containers like glass, plastic bottles, cups, everything. All this hold the water, then there will be a breeding. Next. Next slide. Oh, so this why we need to know that only if we keep our home inside and surrounding, it does not prevent us from dengue, because the flight range of this mosquito is 400 to 500 meters. That is half a kilometer. So if we want to be safe from this mosquito, surrounding our home or office or school or college, nearly half a kilometer area, it should be free from breeding and mosquitoes. So that's how we need to work out. That's why we are today talking to the Bangalore apartment federation association people, so that you will have large apartment area and complexes where everyone lives, and you will have contact with each other, so that if one of you know these things, then you can tell others also. See, if I keep my home, my surroundings clean, that is not enough for this prevention. Everyone has to be know this, how it is spreads, and prevent this bleeding. So that's why cleanliness of surroundings, the apartment association uniquely, they can coordinate with community members and do this activity so that everyone is safe in your apartments. You should not get bite from mosquitoes. So the water tank, sump room, if there is a open water storage is there, that can be a breeding site. The swimming pool, if it is not cleaned regularly, weekly once or 15 days once, then it can be a breeding site. Basement parking area, if there is a waste thrown away which contains water, or tires if it contains water, or during rainy season if there is water stagnation, clean water, then the fountains where if it is not cleaned weekly once, then it may be a breeding sites. AC, cooler, rooftop, the plates which are kept below the AC units that may during rainy season that may contain the water and breeding may occur. And rooftop, if there is a blockage due to drainage pipe, then if the water storage is there, then it will be a container. Next slide. So these are some of the photos from Bangalore only. See the AC tray, the tray behind the fridge, that also may contain, and pet water balls which are kept in the compound or outside the houses. Some of the people usually they keep it for dogs so that they can drink water. If it is not cleaned properly every day, then it may be a breeding source. Then flower pots, already we have discussed this. Buckets and stored containers, if they are not closed properly, if they contain water, then it will be a breeding site. Next. So what is the solution? So we day to day, at least weekly once, we need to clean everything which contains water. These plates, flower pots, money plant, then buckets, drums, then if there is a waste thrown out outside, that can be cleaned weekly once. Next. So chemicals, what are the chemicals we use? Usually from the health department and GBA people, they do fogging if there are more number of mosquitoes. So as I told, fogging will not help this prevent this dengue because the adult mosquitoes will die, but the source will be there. Again, the mosquitoes will come and bite and it will spread. And we use Temifas like 50% EC. Wherever there is, we cannot close, we cannot reduce, we cannot clean that water. Then only chemicals are being used. And fishes, some of the large water bodies, wherever is there, so we use fishes also. And for adult mosquito control, if there is outbreak like situation, if there are more number of fever cases, dengue cases, then we use pyrethrum 2% mist blower or cephanothrine fogging is carried out by the authorities. Next. Weekly dry day activities. This is one thing we tell everyone in the districts also, Karnataka, in the rural area. Also, we tell every household to have a look inside your house, surrounding your compound, so that weekly once you can clean everything and dry it, clean it. Then if you do that, then it will be very helpful for you and you can prevent dengue. Next. So stay connected. Your 𝗵𝗔 medical officer will be nearby. Our healthcare staff will be coming door to door. They will be giving you the IEC material pamphlets and they will be checking your compound, and if you allow them inside, they will check houses also. They will tell you where the breeding is there, if it is there. Otherwise also they will check and tell you regarding dengue and how to prevent it. So Bangalore Apartment Federation is a very good association which has got 1,500 apartments in Bangalore city. If you people can coordinate and these simple things, day-to-day activities, inculcate in your daily habits so that you are safe from dengue and your family members, your children, surrounding your community, everyone will be safe. If any questions are there, our healthcare staff, medical officers will be nearby only. You can contact our GBA and health department helpline number also. You can take clarifications. And we are available 24/7. You can contact us also, so that all living in apartments, this Bangalore Apartment Federation people can have a dengue-free GBA. So next. So clean surroundings, not just clean premises. Every household, every common area, every neighboring plot, dengue prevention is a shared responsibility. Thank you very much. Now over to Kamala Madam.
Thank you, sir. It was a nice presentation. So now Dr. Venkatesh will speak or Dr. Suresh?
Madam,
good evening,
today I
madam.
think both are
Not there. Okay. So we will take
Yes,
up the
sir.
questions then.
Dr. Venkatesh sir is there. Sir, yes, sir,
Okay.
Venkatesh sir, please.
So
Sir,
Dr.
good evening.
Venkatesh,
Am
Good
I
evening,
audible?
sir. Good evening, sir. We can hear you, sir. We can hear you, sir. Please go ahead.
Madam, good evening.
good
Sharif
evening,
sir,
ma'am.
good evening.
Yeah, Dr. Venkatesh is work closely with the SPO and looks after the management locally. He will enlighten us with the practical issues and remedies by giving some tips. Over to Dr. Venkatesh.
Sir, thank you, Sharif sir. I think Sharif sir has told you about the menace of this tiger mosquito, that is Aedes aegypti, how it breeds, where and all it is breeding. Especially rainy season is favoring the breeding habitat of this mosquito. Mainly the GBA is focusing on involving various communities. We have different stakeholders like apartment federation or apartment association, resident welfare associations, and in slum areas we are involving Mahila Shakti groups also. And through our campaign, we are creating awareness among school children and even various government offices also are targeted. Even parks and all being addressed. Our activity mainly involves source reduction activity. We have field level workers like health inspecting officers across 369 wards, and we have public health primary healthcare officers, and we have mosquito spraymen at field level. So they will have a list of areas where the high breeding points are happening, and we are coming to know this by reporting of the cases through one of the IHIP portal is there, so that we will be getting the reports. So based on the reports, the inspection will happen from our ward level officers, and they will carry out the source reduction activities. Why this meeting is important? Because we want to involve even apartment federation and various apartment associations also, because once we educate them what to do and why it is important, and they will be the owners of their apartment complexes and surroundings. So one of the biggest initiative recently I heard that our honorable Bengaluru Development Minister and Honorable Chief Minister, they have started this vacant site cleaning drive. By 15th August, everybody who is having some vacant sites in Bengaluru city, they should clean up the sites. So why it is important in our context means because we see a lot of the waste being thrown into vacant sites, wherein there is a lot of scope for this collection of water whenever the rain comes. And if there is rain, then there will be accumulation of water in the containers, and there will be breeding happening in that locality or vacant site. So today, in my view, we should concentrate around half a kilometer from your residence. That means if you are in an apartment, we should concentrate 500 meters surrounding circle, wherein we should see how many vacant sites are there, whether they have been cleaned up or not, who is the owner of that site, whether we can convey the message that they should own up this drive and clean it up once, so that if it is cleaned, so we are definitely sure that there will be we are eliminating that breeding points. So I request you people to take this drive and see to it all the vacant sites in your surrounding, at least wherever you are residing, from your apartment 500 meters. If there are vacant sites, let us take this seriously and do it. And second thing, we are having this health inspecting officers also. So they will be visiting your apartment complexes. My request is to allow them for inspection. And we are planning to conduct an awareness campaign for the managers or state officer or the maids or the gardener, whoever is helping you out in your apartment complexes. So we will be training them why this mosquito is important and what should be done for the source reduction activities. Once it is done by the person who is actually managing your inside the house and surrounding your residences, then we are definitely 100% sure that there is no breeding. One thing I request you people is about this overhead tanks. Most of the overhead tanks we see uncovered in Bengaluru area, in some of the localities. You have to personally inspect. One of you, I think, any of the person from the apartment complexes, he has to go to the terrace and inspect the terrace. If there are water collection, whatever the containers are thrown there, you should see to it is cleaned up in terrace, and see to that the terrace, the sump or the overhead tanks are completely covered. That is my request. So if it is done in a war food basis in next 15 days, then we will not have that amount of this dengue upsurge in Bangalore. Already, Sheriff sir is daily sending us the list of the positives, and it is going up. Last week we had around 30-40 cases. This week it is going up to around 90 cases we are getting daily, 90 positives. So that means to say there are a lot of, in the coming days, there will be a threat in Bangalore city that anytime this dengue might increase because of this breeding tides. So my request you people to see to it, your surroundings, at least 500 meters, is clean from any breeding sites. So apart from this, if there are any questions, I am willing to answer. Kamala madam.
Thank you, sir. So there were a few questions from the applicants even before the meeting. One is there any special team providing proactive services to apartments? If so, can we have the contact number?
Madam, the nearest point of contact for this is our primary health center, urban primary health center. So they will be covering up the entire ward. We have definitely shortage of manpower.
Yeah.
If they request beforehand, we can train them and we can ask them to inspect and see to it breeding sites are eliminated.
Okay, sir. Second question.
Just want to add a point to it, ma'am. So basically, this is a inside home breeder. So it is most of the responsibilities lies within the residence. So this is one disease where our efforts can create a lot of difference. So rather than any other departments like involving or health department or any other department for that matter, because two important points you might have noticed. One is which Dr. Sharif has mentioned repeatedly. One is it breathes in clean water and it lives within the home. It breathes within the home. So it is very important for us to take a responsibility and ensure that the breeding point, to ensure that there is no breeding point within our home as well as our surroundings.
Okay, so thank you. Despite mosquito treatment,
May I come in, doctor, on this?
Yes, sir.
If we can get the list of UPHC centers, then we can publish in our network or send as a follow-up communication after this event.
Sure, sir. We can do that, sir. Sure.
We can do that, sir. No problem.
It will help us. Next
Sure,
question.
we will share the list of PHC.
Despite mosquito treatment by the pest control vendors, their menace continues. So what are we missing here is another question.
Madam, actually, the right way of doing source reduction activity, we have to teach them also, the pest control people also.
Yes.
See, I see a lot of time whenever they are spraying, they'll be spraying on open land.
Yes.
Where there is no water, and they'll be spraying to shrubs, and they'll be paying to some corner or mori. It is a wastage of whatever the medicines they are using. Because unless there is water, there is no breeding. So we have to target the breeding sites. As Ravi Shankar said, it is most of the time inside the house. Our these plants, indoor plants, below that you keep one tray. There will be stagnant water. And inside the house, overhead tanks and our sajjas, where we throw our waste material, there is possibility of accumulation of this water, rainwater. And our coolers and fridges, below that, there will be accumulation of water. So we should concentrate first inside our house. Whatever the possibilities are there for breeding, we should concentrate on that first, and we have to eliminate that first. Second thing, our surroundings. It is a domestic as well as very domestic breeder. Very domestic means surrounding the houses, where there are possibilities in the walking area or in your park or wherever you are sitting in the evening hours. Or after the morning walk, people, especially aged people, sit in parks. And after the morning walk, you will be sitting inside your apartment complexes. Surrounding that area, that is around 400 to 500 meters surrounding wherever you are residing, we have to search for breeding. It is a collective work. GBA alone cannot do entire survey. There is manpower issues. Still, we can help you out. If there is participation from your side, definitely we can eliminate. It is a collective effort.
Yes.
Just to add to that, ma'am, as I think Dr. Sharif sir has mentioned it very clearly, fogging just kills the adult mosquito. But the next ones, today if we fog, then we may kill some hundreds of mosquitoes. But tomorrow again, thousands of mosquitoes will come from the breeding sources. So the direct answer to it could be the reducing the sources. Reducing the breeding sources is the key answer for this. And another thing which we are also working on is like we have also in working along with the pest control organizations. And as Dr. Venkatesh sir said, we are trying to train them on what they actually needs to do, where exactly they have to spray, and they have to focus more on. See, another problem is when some pest control organization says that we have come and reduced the sources, people may not accept it or this thing. That is also the reason like they are trying to fog. People's mentality is that if fogging is done, then mosquito is gone. Actually, it is not. Yes, of course, it is a stopgap arrangements. It may reduce for that particular day, but next day again the next batch of mosquito is ready to come out. So the important thing is reducing the sources. Even when some pest control organization comes to your organization, comes and visit your apartments or your housekeeping team or the maintenance team, please ask them to work on reducing the sources of mosquito, not only on the adult mosquito. Yeah.
The another question that is coming up is, if it is for dengue, these points are correct. So they are telling mosquitoes prevention is for other diseases like malaria and all, for which this may help. So how to answer that?
Madam, for dengue, malaria, mosquito is the vector.
Yes.
Okay. You know that mosquito spreads the disease.
Yes.
So malaria, it is Anopheles mosquito. For dengue, it is Aedes aegypti mosquito. This main activity should be source reduction for both. If you eliminate sources, automatically there will be no breeding and no mosquito and no spread of disease.
Yes.
So according to Ravi Shankar, what he told, fogging will not prevent any dengue or malaria outbreak. See, the mosquito is very intelligent. If we are doing fogging in this corner, it will go to other corner.
Yes.
It is so intelligent, it will escape for that period, and automatically it will come back.
Somebody asked. Yeah.
Yes, ma'am.
No, somebody asked a different question: how to get rid of cockroaches at home? Not related to this session, but if anybody can answer.
Cockroaches we are not dealing actually, but
main thing is pest control only. So that's like yeah.
And about the vacant site, whom to report is that another question.
Madam, vacant sites, it is, I think GB has published a notification wherein if there are vacant sites not cleaned, you can report it through our 𝗪 application. One 𝗪 app is there in GPA.
Yes.
So that you can always report and you can take a photograph and send it. I'll share the phone number also.
Okay.
So that anybody who is having vacant sites nearby to their apartment complexes, they can always report that this site is not clean like that.
Yes. Thank you. Vaccination is a point which sir has already discussed. And I also came to know it may come only next year. It is still under production. So this answers the question. Correct, no, sir?
Yes, madam. Yes, madam.
Yeah. So regular fogging is of no use. That is one of the points we have learned today. And stagnation to be fixed first. And the responsibility of maintaining the cleanliness is the every person's duty. So mosquito control is best is a prevention than controlling the disease. These are the summary points, if I am correct.
Yes, madam.
Just couple of things. One is like as Sharif sir said, prevention is always better than cure.
Yes.
And one more important slogan we have to remember as far as self-help is a best help.
Yes.
So keep our house and also the surroundings of our apartment bleeding free. So that always that can lead to unhealthy living conditions for our elders, and most of us has elders at home. So both for and we love we have a lot of loves for both elders and the children. So it is very important to protect them. So it is always we have to get into it and ensure that self-help is and we have to follow that. Self-help is the best. And definitely yes, as Dr. Venkatesh sir said, any help they can reach out to the local UPHC, and as Arun sir said, we will be sharing the list of UPHCs with the wards covered by them, so that they can approach the UPHC medical officer for any further assistance or any knowledge related to dengue or treatment related services. All the UPHCs has dengue test facilities, and also they can give treatment, and if necessary they can refer to the right health facility for further treatment as well. That's what.
Okay.
Doctor,
Any
may
other
I come in?
Yes, sir.
This question or suggestion is to the to Dr. Sharif and Dr. Venkatesh, apart from Ravi Shankar sir. If we can have a checklist, a simple one-page checklist, one for the association and one for the home, then we can distribute digital copies to each of the association, and they can, look at their own checklist for the association and also print and distribute checklists for the respective homes, so that, the awareness is even more deepened from here. Thank you.
Surely, sir. We will give the checklist. And the second thing, what my suggestion is, we should start training our housemates and gardener, whoever is there in charge of the apartment, about the sources of breeding, like different sources we have discussed already. And we can start, I think, if you can allow us to start in any one apartment next week, we are very glad to see that it is done.
Okay. Anyone who is attending this program can raise their hand, and we will schedule it right now, right here. I can see quite a few apartments who come here. This will be at no charge, right, sir?
No charge, sir.
Okay.
Nothing.
Ganesh Bhai? Dr. Kamala, your own apartment?
Our apartment will always be ready.
Okay.
I'm waiting for
Sir, my request is you have to arrange a meeting, maybe half an hour, 1 hour time, of the maids who are attending your apartment complexes, and also the manager or estate officer, whoever, maybe gardener, whoever comes to your apartment complexes. We can arrange a meeting. We can train them. We'll start training them.
Understood, sir. I think we have two people who have raised their hands. One is Ganesh Bhai. One is Dr. Kamala's apartment herself.
Okay, sir.
We will share the contact details with you so that you can directly reach out to them and schedule this session.
Sure, sir. I'll do that, sir. Sir, we can always discuss in the group which we have, sir.
Right.
Okay. And also want to mention that already Dr. Sharif sir has instructed us to create IEC materials, different IEC materials, which is targeting the apartments residents. So that we will keep sharing on weekly basis, sir. And also, sir, we will also do that checklist, what residents has to do, and one single page checklist we will try to create after discussing with Dr. Sharif sir and Dr. Venkatesh sir, and we will keep sharing, sir. And I think our engagement is going to be continuous, sir. It is not that it gets over with this webinar. So we will be, we are also working on a citizen engagement part, wherein we can get much more information from citizens and how to work on that. So we will keep working with you continuously, sir, and we will be in touch continuously with you. And definitely you can also reach to us any help which is related to health department, those things you can always mention in that group, so that Dr. Sharif and Dr. Venkatesh sir can help us in that, sir.
Yeah, that is wonderful to hear, sir. What we will also happy to contribute is reviewing that checklist, reviewing that IED material, and providing any additional inputs that we may have.
Definitely, sir. All the materials will be shared with in the group which we have.
Right.
You can have suggestions on that and recommendations on that. Once we finalize, then you can broadcast it in your 1,500 members or whatever the group you have.
Perfect.
Yeah.
Perfect.
Ravi Shankar,
thank you, Dr. Kamala.
Please, sorry, madam, if I interrupt. Ravi Shankar,
No, sir, please.
Please take Dr. Kamala madam's apartment address also.
Yes, sir.
And
Yes,
let us know when she is able to arrange the meeting. And we will convey the nearby UPHC, whoever is attached to that apartment.
Coming Saturday, I will discuss with my team and let you.
Yes, ma'am.
Please let
I'll
us know.
coordinate with you, ma'am.
Yes, sir.
I'll coordinate with you, and I think one more, Mr. Ganesh Pai has also showed interest, I believe.
Yeah.
So if that can be finalized and we can keep informing the group, definitely we can have meeting with the individual apartments as well, ma'am.
Okay, sir.
So, Kamala ma'am, thank you, Ravi sir. I'm from Surya Hummingbird. We are in Chanachandra, Corridor. So we'd also like to have this awareness drive in our apartment whenever possible in the coming weekends. Please let us know.
You have to give us the date. You have to give us the date and time, preferably morning hours or afternoon or maybe evening before 5:30, so that we can have a get together, whichever is convenient. Maybe morning time, I think maids will be coming.
That's
maybe
right.
around 11 o'clock, 12 o'clock, if you can arrange, we will train them.
So next Sunday, 11 o'clock.
Ravi Shankar?
Yes, sir, we can work it out. We will coordinate with Arun sir and Kamala ma'am.
Sure.
And we will,
Yes, sir.
Yeah.
I think the hesitation from their perspective will be because it is a holiday for their staff. So to pull them in maybe is a challenge. That may be the only thing. So if this can be done any day during the week, I think they will be immediately able to latch on to that.
That will also be, that will also work because many of the residents will be available in the morning time. So we can do it on working days as well.
Oh, okay. Deepankar, we don't have your contact details. I don't think you've registered for today's program, so you joined, I think. So if you can use the registration link and join, put your details, we will share that further. That link is still open. Please register, and we'll share it with them.
Definitely. Thank you so much.
All 1,500 apartments we should train, sir, by another maybe 15 days, 20 days time.
So we will open this offer to everybody, sir. So whoever is interested, can raise their hands, and we will connect them.
Arun, Ganesh here. This is Ganesh.
Yes, Ganesh.
Yeah, so I'm okay. What I'll do is my contact information is anyway there with Kamala and the entire BAF team. So if you can reach out to me, and if the PHC team can reach out to me, I'll connect you with our estate manager, and we can organize a session with our housekeeping team anytime during the weekend. We can get that rolling.
Good, sir.
Only weekend, Ganesh?
No, anytime during the week. Just give me at least a day or two's notice so that I can inform the housekeeping and the estate manager, and then we can get it started. There's no bar on any day of the week is fine with me.
Sure.
But just I need a day or two's notice upfront.
Absolutely. What we will do is we'll share your contact details with Dr. Ravi Shankar. Either Dr. Kamala or I will do that. Perfect. And then Mr. Ravi Shankar, who will be calling Ganesh?
So we need to understand which corporation he is from. There are 5 corporations, so we will have.
That's okay. Someone from your team, if they can call first and then connect. He will be in South.
That will be great. That will be great. Yeah. We are from Bangalore South, so we are on Banagata Road near 𝗪𝗍𝗪𝗏.
Okay.
So that comes to Bangalore South.
Yeah. Okay. Then one Mr. Nidhi, who is also in this call. He will get in touch with you. You can share the number. I will take your number from Arun sir, and I can follow it up with him. Yeah.
Done. Okay. Thank you so much.
Okay, it's a very good session. This time it was even better than the last week. So we thank all the speakers and also all the participants who have gained knowledge through this. We think we can prevent this disease to becoming more and more rampant and serve the people. So with this, I think we can close this. This initiative was very important for us. So we will follow it up with the whatever discussions we had, and we hope for the best. Thank you, everybody.
Thank you, ma'am. Thanks a lot.
Thank you, sir.
Thank you so much, Dr. Kamala. And thank you so much, Dr. Sharif, Dr. Ganesh. Ravi Shankar
Thank you very much,
and the entire team. It was a wonderful session. Yes, like Dr. Kamala mentioned, better than the previous one, and a lot of follow-up action that we have and can do. And I think we need to feel that, prevention of dengue in this city is in our hand, my hands, and we can definitely contribute towards that and move forward. Thank you so much.
Thank you.
Okay.